morning, everyone. I'm Megan Cullip, along here with Scott Michlin.
Good morning. It is Monday, July 27th.
It is.
Yeah. Week
21.
Did you do the math?
21.
You did. You sure? Okay. You said it with such confidence, and I'm just
yes.
okay, all right. Because I know last week there were some questions about what week of are we in this handbasket?
Well, it's
I didn't want to say,
confidence and enthusiasm usually carries the day. It's
okay.
true.
Week 21, she says confidently. Here we are. Anyway, welcome everybody. It's our COVID-19 local information program, and we're glad that you are with us. We've got a lot of information to share. Again, some great guests lined up. We'll be hearing from Jeff Bourgeois from San Juan Regional Medical Center for kind of a weekly update, if you will.
Yeah.
Also, on the education front, Danielle Sullivan is going to be talking with us. So,
education and service.
Service learning.
Yes.
Yeah, so we're excited about that as well. But we'll start with the numbers like we do, and let me get them called up here because
sounds good.
We have them ready. Let me get to my correct keyboard to do this properly.
Lots of buttons going on over there.
There are a lot of buttons going on.
Did you used to play like Atari and stuff? Was that like your thing?
I wish I had an Atari. I really wanted one, but that didn't happen. Yeah, Frogger. Maybe back in the day. Yeah, that's true.
Yeah.
Okay, hold on. We're getting there. But anyway, you've got the Johns Hopkins numbers
I do
that
have
you were
the
about
national
to
numbers, yes.
share with us. And
yes.
I was going to throw those up here in just a moment.
The dashboard.
When we have them.
So the United States confirmed 55,910 new cases of COVID-19 yesterday, with 6.5% of the 855,811 tests reported coming back positive.
Okay.
So that's an additional 474 deaths were attributed to the virus on Sunday, bringing the pandemic's American death toll to 146,934.
Got it. All right. And we can see on the screen, again, we have the top 50 confirmed cases by county. And Los Angeles County is number one, followed by, which is California, Maricopa, which is, of course, Phoenix, Arizona, Miami-Dade, which is Florida, Cook County remains to be Chicago, Queens in New York. So that we keep hearing about the outbreaks in Florida and Arizona. So
and
not
also
surprised.
Apparently Los Angeles County.
And Los Angeles County. That's true.
Southern California.
That's true.
Let's not forget them.
Very true. In our state, in New Mexico, we had 266 new cases on Sunday. For a total, we're now above 19,000 in New Mexico. San Juan County, again, with 4 new cases yesterday. So, again, our numbers have kind of been trending very low in the last few weeks. And I think a lot of folks are
for our county
thankful to see that. With 7 additional deaths across the state in New Mexico, but none of those were in San Juan County. So our number of deaths remains at 177, and there were 81 new recoveries reported on Sunday. And as we go to the next page, Navajo Nation, 54 new cases on Sunday reported, 5 additional deaths across the Navajo Nation. And so that was the numbers that they were reporting as well. And their numbers seem to have been kind of lower than they had been as we watch these day to day. And so there you go. So that's the latest.
Total number of COVID-19 positive cases for the Navajo Nation is 8,891.
8,891, that's true.
Yeah.
Yep.
I feel like that's notable.
It is a notable number. So very true. The other things we wanted to share, there are some more testing results going on, or testing clinics going on this week here in San Juan County. So I wanted to share that information with you as well. And that is here. So today we had them here at San Juan College. And again, tomorrow in the evening, we'll be back here at San Juan College from 6 to 7 p.m. On Wednesday, July 29th, from 8 a.m. to 9 a.m. at Judy Nelson School in Kirtland. Thursday, July 30th, back here in the morning at San Juan College from 7 to 9 a.m. And on Friday, July 31st, back here at San Juan College from 7 to 9 a.m.
It's a very pleasing graphic for our radio listeners.
Yes.
It's actually quite calming.
Right.
The light blue and the light green and the trees in the background. It's very soothing.
Shout out to the Department of Health for designing that, right?
Yeah.
So there you go.
Oh, it's such a serious topic, but,
You're right.
Calming.
But it is.
Thanks, Department of Health.
We've had little sunbeams and things on previous posters, so they're very creative.
They're trying to be positive here
They are.
these days.
They really are.
Keep carrying on.
That's true. That's true. Another thing we wanted to mention, too, is the non-congregate shelters are looking for donations.
Yes.
And we've talked a little bit about those.
We did.
We had a guest on.
With Suzanne Steitzinger.
That's right. Talking a little bit about how those are set up and what their purpose is. And then the call has come out now for donations and how to drop those off. And I do have a graphic for that as well.
Ooh, is it as pleasing as
probably
the
not.
other one?
No.
No, it's our characteristic yellow.
It is.
Okay.
It's our sunbeam yellow, so it's still kind of friendly.
It's cheery.
Yeah,
Okay.
right. But they're looking for donations of these types of items on the screen right now. And so radio listeners, we can read them through them for you. But toothbrushes, toothpaste, those things that you would think folks in a shelter might need. Razors and shaving cream, socks, underwear, pants, and shirts for all genders and sizes. Snacks, I think, that are probably self-contained.
Non-perishable, of course.
Right. Books and puzzles, gift cards for purchases of over-the-counter items like Tylenol, Alka-Seltzer, etc. So those types of
OTC.
things. Right.
Over the counter.
Exactly. And so that's
Snacks and books.
what they're looking for. Yeah.
What kinds of books you think?
Good question. I don't know.
We should have asked.
I don't know. But there you go. I'm sure they would take for all ages, all genders.
Cool.
It doesn't matter.
I'll drop off my Farmer's Almanac later today.
From 1975?
Yes.
They will enjoy that, I'm sure.
It's going to be a year of famine.
That will help even out a table. But anyway, drop-off locations are at 308 West Broadway in Farmington on these days, Tuesdays, Wednesdays, and Thursdays in the afternoon from 1 to 5. Fire Station number 1 on Auburn in Farmington every day, it looks like, from 8 to 4. And then, as we mentioned, Suzanne Steitzinger is the San Juan County Shelter Site Coordinator, and you can call her at this number, 320-0514.
Yeah.
And I don't know why I think you can't read off a screen like I can, because
Yeah.
you certainly are
Well, I was
capable
just gonna say
of
that
reading these things, too.
I see. I'm a person that can remember the name of the site more than the address, right? So it's GC Harvest, which you'll see there's a giant window and it's painted on there. And
On
then,
Broadway.
of course, the firehouse is easier to spot. So there you go.
Exactly. Very good. So that's neat. I know they've needed that, and so we've been wanting to mention this since Thursday. So we're glad
So here we are.
Finally did. That's right. So there you go. Let's go to the phones.
Cool.
So we go to the phones. Good morning. Good morning. Thank you for calling into KSJE. You're on the air.
Good morning, Scott. This is Jeff Bourgeois. How are you today?
Good morning, Jeff Bourgeois, President and CEO of San Juan Regional Medical Center. We are well. Thank you for calling in, and we appreciate that very much. And so, give us an update, if you would, on conditions there at San Juan Regional this Monday morning.
Well, I'll be happy to, Scott. Our COVID floor census today is 34. 8 of those are in the ICU, and several of those are intubated. Our overall census today is 125. What we've seen over the past week is a little bit of decline in our overall inpatient census, and that really makes sense when you look back a couple of weeks at the positivity rate we were seeing on our tests. It takes a while for patients who are going to get sick enough to need hospitalizations for their illness to progress before they actually come to the hospital. The good news is when we look at our more recent results from testing here at the hospital in particular, going back to July 22nd, we've seen a sharp fall off in the percent of positive test results that we've been experienced compared to dates July 21st and prior. So that should, if that trend continues, convert to fewer COVID-19 hospital admissions over the next couple of weeks.
That seems, I'm sorry to interrupt you, Jeff Bourgeois, but that seems to coincide with what we see on a state level, that our region of New Mexico seems to be performing better compared to maybe other hotspots in the state now after we were the hotspot for so many weeks.
Right. That's, our 3-county region up here in the Northwest has the lowest R effective rate of any region in the state. Also, some good news that we saw from the state's website, their most recent number shows 144 hospitalizations statewide. That number peaked well over 200 in mid-May, and it crept up into the 170s about a couple of weeks ago, and last week was still in the 160s for several days. And so that's dropped down to 144 also. So, hopefully, we'll continue to see that trend turn downward. It's awfully early though in that trend to make any predictions, but still some favorable results over the past few days. One thing I do want to make sure your listeners are aware of, again, is all the public testing available through the Department of Health. Today at San Juan College from 7A to 9A, so it just finished. And then tomorrow, again at San Juan College from 6 p.m. to 7 p.m. On Wednesday out in Kirtland at Judy Nelson School from 8 a.m. to 9 a.m. And then on Thursday and Friday back at San Juan College both days from 7 a.m. to 9 a.m. So those testing sites are still available in our local community, and people are concerned that they have a need to get tested. We encourage the community to go to those public testing websites or sites supported by the Department of Health. We, of course, continue to test patients who present symptomatic at the hospital, as well as who need a pre-procedural COVID-19 test.
Very good. And Jeff, we've heard some stuff about patients being transported from Arizona. Is that happening at our regional facility because our numbers are so much lower, or has that yet to occur?
Hi, Megan.
Hi.
It is occurring, and we routinely take transfers in from Arizona, particularly the northeast part of Arizona, even going as far south as Fort Defiance, Window Rock area, Chinle, Cayenta, those types of areas. Routinely transfer patients to our facility, even in the non-COVID environment. So we have seen those transfers for the duration of this pandemic and expect to do so. I don't have any current numbers on any Arizona transfers that were coming from areas outside of where we would normally get Arizona patients from.
Understood. And I guess, Jeff Bourgeois, as you look at our neighboring states and some of those numbers and how their hospital systems are kind of working to deal with all these numbers, and I don't know if straining is the proper word to mention, but we hear stories about the number of beds being maxed out and things like that. And we have talked, I know, with you before about how New Mexico seems to have managed this issue a little bit better and doing well. And we never really had the overrun of our facilities that so many of us had feared early on. So again, I guess my question, if there is a question in this statement, is, compared to other states, do you feel that our system is still working the way it was designed to and working well on behalf of our residents?
Yes, Scott, that's a great question, and I do feel our system at the state level here in New Mexico continues to work well. I participate in a twice-a-week call with 6 other hub hospitals in the state: Santa Fe, Las Cruces, and Albuquerque, and Roswell, and we check our current COVID patient populations, our ICU capacities, coordinate any details that we need to amongst the group there, and then share that information as then shared, particularly with the core hub hospitals down in Albuquerque. So that continues to work well. None of the ICUs right now are really past capacity, but most, including ours, are still using our contingency ICU capacity that was created so we would have COVID and non-COVID ICU level of care for our patient population.
Very good. And I see the SJRMC Facebook page periodically, which is very helpful, and we see some addresses from physicians and yourself. And I've also seen a lot of physician new hires, and I just wanted to sort of point out on air that seems very positive. Like the hospital business still continues on, and this COVID thing is, present as well, but it seems like there's a lot of great things happening
I know
that
you've
too.
reminded us that, and other doctors, Jeff Bourgeois, have reminded us to keep coming to the hospital if we have problems or other health issues that need to be dealt with. And I think, as Megan's mentioning, you're still hiring new physicians and bringing new folks to the community to help keep us healthy.
That's right, Megan and Scott both. So we do have a number of new physicians joining our community this summer and on into the fall. Pinion Family Medicine is adding a family medicine physician this summer. His wife is a pediatrician. She will be joining our pediatric clinic here at San Juan Health Partners. And then hospitalist, internal medicine, and a pediatric hospitalist all coming to us this fall, in addition to another cardiologist from Colorado, Central Colorado, joining us in October of this year. So we're excited about that. And then, yes, I mentioned in our weekly update last week, Scott and Megan, that we have opened our clinics and our procedural schedules. We will use COVID-safe practices everywhere, and really want to stress the importance for seeking care if you feel you need it. It's been a bit of a national circumstance that patients who have an illness or injury unrelated to COVID have been hesitant to come to hospitals just across the country, and that has created circumstances where patients are often presenting very late in their disease course, and it makes their recovery and treatment that much more lengthy and difficult. So if you need to see a physician or have an emergency medical condition, we urge you not to hesitate. Our practices are set up to care for both COVID and non-COVID patients.
And kept very separately, I would add, too. So that's another point I think it needs to be made. But Jeff Bourgeois, we appreciate your time when you talk to us every week. Thank you so much. And again, for all the folks who are working with you at San Juan Regional Medical Center on the front lines of all this, who have been there week after week, we appreciate their efforts all so much. Thank you.
Thank you, Scott and Megan. You all have a wonderful Monday.
You too.
Thank you very much.
Bye-bye.
Bye now. That's Jeff Bourgeois, the president and CEO of the San Juan Regional Medical Center, speaking with us on our COVID information program.
Always interesting.
Good information.
Yes.
And again, glad to see that we are not overwhelming our healthcare facilities. I think that was a big fear.
In fact, we're able to help out other states, which is a big deal.
I know. That is a nice love thy neighbor moment.
Oh.
Right?
Right.
Yeah, I mean, I think it is.
Our purpose in life.
There you go. That's true. We have another guest.
Yes.
Who is on the phone with us this morning. Good morning. You're on KSJE. Thank you for calling in this morning.
Hi, Scott. This is Danielle.
Danielle Sullivan from San Juan College is calling in. Good morning. Good to talk to you, Danielle. Thanks for doing that. I know we wanted to speak with you a little bit about things here at San Juan College, and as we get back into the swing of things in the fall with the fall semester, and Megan is here to talk about service learning.
That's right. Yes. So, I had received an on my other hustle. Right,
yes,
outside of
so
ASJ,
many.
So many
I don't know how you keep track of them all. Yeah.
Sometimes I don't. Anyway, so I got an email from Danielle because there are various after-school programs around town, of course, and you had mentioned that part of your role in service learning is to try to connect students to service opportunities, and one of those ways might be that school, as we know, is starting online before in person, and we're hoping to get back to in person, but for the time being, it's online. And so do you want to speak a bit more about that, your idea in that regard?
Yeah, absolutely. So service learning, first of all, I'll just preface it with a bit about service learning at our campus. It's an integral part of a few programs, and then many other students participate in service learning, but particularly in our human services programs and health sciences, many students. We have about 700 students that participate each semester in some form of service learning, either individually or as a whole class. And so obviously with COVID, that's made things really tricky because we don't want students going out into the community, and the organizations don't want to bring in additional people. So we've been looking at needs in the community and ways to address them, both to meet the needs of our students and then the needs of the organization. So one of these ideas, and Megan's other, I like how you call it a side hustle. That makes me want to go to church. But Megan's other job is with this homework club at the First Presbyterian Church, and we know that there are other organizations, as she mentioned, that are working with youth and also schools. So I'm looking to partner in kind of a Zoom buddy tutoring. So we have a math ed program, we have reading, and just lots of students that examine literacy, early childhood needs. And so we're trying to partner students with either groups of students or of K-12 students or individual K-12 students who might need extra support for math tutoring. We have language students, so Spanish and Navajo, who might want tutoring or just to talk in Spanish and Navajo. And then we have a lot of reading students and human services students who are really interested in working on this.
Very good. And so how would students connect? I mean, I know that this is the early stages of brainstorming this, but say one had a very unmotivated and non-self-directed teen at home. How would I connect with your program?
So what I'm hoping is that organizations and even individual families, because I think we're all kind of scrambling here, and some families are recognizing, like you said, if you have an unmotivated teen or whatever, but they're recognizing that they have some kids who might be getting some academic gaps and need some help with that. So the best way to do that is to email the HIP Hub, that's the High Impact Practices Hub, and Service Learning's under that. So it's simply HIP Hub, HIPHUB, at sanjuancollege.edu, or to give me a call at 505-566-3476 and let me know. And then what I do is I've created this virtual service learning office, and so it's linking to one part of that office is linking to a live document that's updating regularly what the service learning opportunities are for students. So all students who are doing service learning have to connect with me to fill out paperwork and whatnot. And we're hoping that there'll be some training. I do some general training and discussion with them, but we're going to bolster that a little bit this semester just because of COVID and how things look a little bit different. Make sure everybody's safe.
Very good. And I imagine you're going to get a lot of connections from that email address or that phone number, Danielle Sullivan, of parents maybe who are looking for some assistance as a school starts to ramp up in the fall, and for your other San Juan College students who want to take advantage of this. Again, same thing. Can they just reach out to you through that those contacts to sign up for this service learning opportunity?
Well, usually yes, they can, of course, but usually their instructors assign it. It's part of their coursework. So they'll learn more about that as they're enrolling in their classes. And we have other options too. Like right now, this is fairly well under development. We're just finishing some of the kind of the fine points. We're going to have some partners with some nursing homes to be Zoom buddies with some of the older in the nursing homes because they've been lonely and isolated because no one can visit. So we're going to try to kind of almost like a virtual pen pal where they can get on once a week or twice a week and talk with people to help keep them company. And we're looking at students hosting book clubs for kids as well. So they would Zoom in, and it might be a special topic like animals, and there'll be, a series of book club, books and reading, or Percy Jackson or whatever. So we have a lot of interesting things going on for, even though we're virtual.
Yeah, that sounds great. I just immediately looked at Scott and was like, nursing homes, how are we going to train those folks? Is that part of the whole service learning thing, is to train everybody how to most effectively use Zoom, like mute your mics when you're not talking? My personal pet peeve.
Yeah.
So the nursing home that I've been talking with, she would be conducting virtual trainings about how to talk, how to keep the conversation going, especially because some of the residents might not they might have some health issues and whatnot that make it difficult to converse the way you and I are right now. So all of these, so service learning, it's not just service, it's that learning part. So there's always that learning, connecting it to their course, and then getting trained in how to be effective in whatever they're doing. So we don't ever just throw anyone in there and say, go do this without some support.
True, very true. Well, it's a great program, Danielle Sullivan. I know it's been here at San Juan College for a number of years, and it continues to do great things in our community, even virtually. So, thank you very much.
Yeah, thank you. And so, just a couple final comments before we hang up here. So, any organizations that might be interested in pairing with the San Juan College students, please contact me at hiphub.sanjuancollege.edu. And then students, you'd asked, how do they find out about this? Students, in the next couple of days, San Juan College is hosting virtual webinars so that students can learn about what their experience is going to be like on campus and how the classes are going to look and, what service learning will look like. And those are going to be held on Tuesday and Wednesday at 7 a.m., 12 p.m., and 7 p.m. And there's information on San Juan College Facebook and Instagram, or you can contact Sherry Cummins at cummins@sanjuancollege.edu.
Very good. And I know those webinars are going to be great to kind of let students know what to expect and what's coming here in the fall semester. So that's a great idea. Danielle, again, thanks for joining us, and keep up the great work and keep sharing it with us. We appreciate it.
Yeah, thank you so much for having me. I really appreciate it.
You're very welcome. Thank you so much. That's Danielle Sullivan, everyone, from San Juan College, and another great community member making great things happen.
That's right. You got to love service learning.
And here at San Juan College, pat ourselves on the back.
That's right.
But yeah, we love it.
Hey, I do love it. It's one of my favorite things about living here. Living here would be so much less substantive if you didn't have it.
No kidding.
Yeah,
that's
clearly
true. So we're very grateful to have this institution. But anyway,
I'll be signing a lot of kids up for that.
I agree.
So
there you go.
Yeah.
So as we wrap up today, Monday, you've got some things to share, some more things to share.
Well, just an interesting story that I heard this past week about public shaming when it comes to COVID best practices. So anybody who's on social media has probably noticed a fair amount of individuals that might be publicly shaming folks about masks and so forth and so on.
Okay.
And
I hadn't noticed, but if you say so.
You haven't noticed, really?
I'm just kidding. I'm on social media all the time.
I was going to say, I just feel like our feeds must be different.
Yeah.
But and it's completely understandable.
Well, you have all those side hustles, so I can see why you would be exposed to all that.
There's a lot going on. But
anyway.
So before you,
I'm so sorry.
Before you cut me off. Oh, yes. So
shaming.
Yeah, right. And it makes sense to have, especially we know the things that we can do to keep ourselves safe, and then we have this like visceral rage reaction when we might be walking around and we see groups of people congregating in close contact without masks, etc. And they were making a point that it tends to bother us most, of course, when it involves people having fun. Like, you guys are having fun and you're being reckless, and of course a lot of things that are fun can be reckless, of course. And so they were basically making the point that shame never really works. This public health officer from Johns Hopkins, again, was stating that, it's hard to contain an outbreak if people are afraid of coming forward and admitting, like, yeah, I went to this party without a mask and there were 20 other people there and we were sharing drinks and stuff. And so, which don't do that. That's not a wise choice.
Right.
But that there's a way to encourage folks to do the right thing over shame folks to do the right thing.
Got it. Shame is not the way to do that.
Shame just tends to be not all that effective.
Very counterproductive. Got it.
So check yourselves before you wreck yourselves, guys.
There you go.
On your social media, pull back a bit and and I think we've talked about that before, that it might be more helpful for you to post a picture of yourself wearing a mask or something over shaming another person for not, right? So
very true. And it goes back to those again, some of those retail workers who now there are mask requirements in stores who have to now point out to maybe a customer who's not wearing a mask that they are not allowed in the store and have to deal with all that
Right.
push back.
I know customer
So,
service was already hard.
yeah. So everybody be a little more
Nicer.
polite.
Could you be nicer?
Nice, patient.
Yeah.
All those things.
All the things.
Would be good. Wear your masks, wash your hands. And,
Don't touch your face.
Don't touch your face. And we'll be back on Thursday, everybody. 9 o'clock live on Facebook and YouTube, noon on the radio at KNMI 88.9, and 5 p.m. on the radio here at KSJE. We will see you back here on Thursday, everyone. Have a safe and good week. Bye-bye.